Today I'm sharing 12 health metrics that matter. Why? Well, because we've reached episode 51. And 51 is when your health metrics really start to pay off. Why are we doing 12? Well, let's focus on one of these metrics each month. And in a year's time, you will be in the best health ever. Let's get started, shall we?
Well, hello, beautiful people, and welcome to the Project Joyful podcast. I'm your host, Tracy Tutty, your medical herbalist and high performance coach. So, hey, Project Joyful isn't just about being happy. It's about consciously creating a life you love. It's about remembering how to reconnect with your soul-centered joy. You know, that joy that comes from doing what you love, from living on purpose, and from being in a life that allows you to experience deep joy moment by moment. So hey, let's get started, shall we?
Well, hello, welcome to episode number 51. Today we're talking about 12 health metrics that will really make a difference to your health. Let's get started, shall we? The first one is blood pressure. What is it? Well, blood pressure is a measure of the amount of blood that's pumped by your heart into the space in your arteries where your blood flows through. It's referred to as the amount of resistance. So systolic pressure measures the pressure when your heart beats, and diastolic pressure measures the force in the arteries in between those beats. High blood pressure is also known as hypertension. It's diagnosed when your systolic blood pressure is above 130 millimeters of mercury. You often see this as mmHg. Or your diastolic blood pressure is above 80 millimeters of mercury, or if you're already taking medication to manage your high blood pressure. Now, most people with high blood pressure don't have any noticeable symptoms, and it's a complete surprise when high blood pressure is revealed during a routine checkup. But some people do have symptoms, and they'll experience symptoms such as headaches, nosebleeds, they'll have a red face, or sometimes they'll feel a bit dizzy. Now, high blood pressure can be hereditary, and it can be associated with low nitric oxide levels. It can also be caused by poor sleep, smoking, too much alcohol, or a lot of stress going on. Check out episode 25 for ideas on how to manage your hypertension naturally. There's a link in the show notes. You can also have low blood pressure or hypotension. And low blood pressure is diagnosed when your systolic blood pressure is below 90 millimeters of mercury, or your diastolic blood pressure is below 60 millimeters of mercury. It's not uncommon to have no symptoms when your blood pressure is low. If you do have symptoms, they can include feeling dizzy or lightheaded, especially when you're getting up, fainting, blurred vision, nausea, tiredness for no known reason, or just finding it hard to concentrate. Low blood pressure can be caused by emotional stress, such as feeling fearful. It can also be caused when we're in pain. So your blood pressure also drops when you're dehydrated because there's less blood to circulate around in your body. Our next metric is the waist to hip ratio, and this replaces the BMI. Now, your waist to hip ratio is calculated by dividing your waist circumference into your hip circumference. And studies show you've got a greater risk of developing heart disease, stroke, type 2 diabetes, and dying young if you carry more weight around your middle, so that classic apple-shaped body, than if you carry your weight in your hips and thighs, which is that pear-shaped body. It's because this abdominal fat or abdominal obesity is made up of visceral fat, and this type of fat also surrounds your liver and your other vital organs. And what it does is it increases inflammatory levels in your body, and as a result it can increase cholesterol, it can increase blood pressure and blood glucose. Now, the World Health Organization suggests that the ideal waist to hip ratio for men is less than 0.9, and for women it's less than 0.85. So if you're above 0.86 and you're a woman, or you're above 1.0 and you're a man, this puts you at the at-risk category of developing other health conditions. Now, when you're measuring this, the areas you want to be measuring for your waist is just above your belly button, and for your hips, it's around the largest part of your hip, so over the biggest part of your butt cheeks. The next metric we're talking about is HRV, or heart rate variability. Now, this is a metric that measures the amount of time between each heartbeat and the variations in the timing of that. You see, your body is constantly monitoring and adapting to your environment. It's a result of what you're thinking about and what you're putting in your body. It does this by automatically moving between your sympathetic and your parasympathetic nervous system. And these are often referred to as the one that's responsible for fight or flight, being your sympathetic nervous system, and the one that's responsible for rest and digest, being your parasympathetic nervous system. Now, one way of measuring this interplay between these two types of nervous system is through heart rate variability. So a high HRV score is a good thing because it shows that you're responding to the stimuli of your day by moving in and out of fight or flight or rest and digest. But it's about the overall trend that's showing up in your HRV rather than focusing on one particular number. And you want that trend to be going up over time. Working with your HRV can help you to dial in when it's the best time to rest and recover and when it's the best time to stretch yourself or push through that hard workout. If you'd like more information on HRV, check out episode 32. The next metric is called peak flow. And this one you'll be very familiar with if you're asthmatic. So peak flow is a way of measuring your maximum speed of air that can flow out of your lungs. The measurement is also called your peak expiry flow rate or peak expiry flow. And if you're asthmatic, you will have done this many times and you'll probably even have your own peak flow meter. So whilst you can Google the normal range for your age and gender, the key thing is to watch out for any variation on what's normal for you. So take your peak flow reading each day at the same time for 2 weeks, and this will establish your normal. Then compare your later readings to this normal. So if your strong out-breath is between 50 and 80% of your normal, then that suggests it's time to monitor it and to seek advice from a medical professional. If your peak flow is less than 50% of your normal peak flow, then this suggests that your airways have narrowed, such as in an asthma attack, and that's the time to seek medical attention, and urgently. So do you want to improve your peak flow reading? Now, providing you're close to the normal range, breathwork, singing or swimming can be helpful. Our next metric is gum health. Healthy gums look firm and pink. There's no redness, there's no tenderness or swelling, and they don't bleed when you brush or floss them. Now, studies suggest that there's an increased risk of heart disease in people who have gum disease. Poor oral health can also suggest that there are issues with high blood sugar. So begin by visiting your dental hygienist or your dentist for a checkup, and they'll let you know if your gums aren't as healthy as they could be, and they'll suggest ways to improve it. Now, a build-up of plaque is the main contributor to gum disease, but there can be other contributors. For example, hormonal changes during pregnancy, puberty, menopause. These can increase gum sensitivity. Diabetes reduces the body's ability to use blood sugar, so you might be at a greater risk of developing cavities. Our saliva protects our teeth and our gums, so some medications which reduce saliva production or flow can also have an impact on gum health. And smoking and poor oral hygiene habits, such as not brushing and flossing each day, also have an impact. Our next metric is eye pressure. Now, measuring eye pressure is one of the key tests performed by your optician or ophthalmologist, as it can be associated with the onset of glaucoma. Eye pressure is measured again in millimeters of mercury, just like our blood pressure, and a normal eye pressure ranges from 10 to 21 milligrams of mercury. Ocular hypertension is an eye pressure that's greater than 21 millimeters of mercury. Metric number 7, everyone's favourite, especially if you visit a herbalist or a naturopath. It's all about stool consistency. So your stool should be soft, well-formed and easy to pass. No pushing or straining's needed, and it comes out completely. It's an easy to manage log. No rabbit pellets here, please. You're going for a brown colour, although this can change if you've eaten something like beetroot. There should be no blood when you go to the toilet unless your doctor has confirmed the presence of hemorrhoids. Now, you should be passing a solid stool at least once a day. More than 3 days without a bowel movement and you're in the constipation range. The Bristol stool chart is the most common visual aid when describing your stool. It provides 7 types of stool, from hard pebbles when you're very constipated all the way through to the other end of the spectrum. So check out the Bristol stool chart in the show notes. What can cause changes in your stool consistency or frequency? Well, we're talking about stress, not drinking enough water, inadequate fibre intake, and food intolerances. These are the most likely causes. But there's also some health conditions that can affect your stool consistency and frequency. And these are things like an overactive thyroid, irritable bowel syndrome or the irritable bowel diseases, depression or Parkinson's disease. These can all affect your bowel function. Generally speaking, when it comes to bowels, if anything changes in your own typical bowel function and you're not sure why, get it checked by a doctor. Our next metric is a bit of fun. It's about happily walking 5 kilometres. No need for a sporty sprint here, just a walk is fine. So we need a level of fitness and resistance to keep everything ticking over. So if you struggle to happily walk for 5 kilometres, just start with a smaller distance and build up. Make it fun by chatting with a friend, walking the dog, or joining a walking group. Metric number 9. How easy is it for you to get up off the floor? Maintaining our ability to easily get up from the floor is key to ensuring independence as we get older. It's also about keeping your legs strong, your core engaged, being coordinated, flexible, now not the super bendy yoga ninja type, just a normal range of flexibility, and having good balance. The way to measure this is through the no hands test. And to do this, you simply sit cross-legged on the floor and you get up from the floor without using your hands. Now don't do this if you have dodgy knees or ankles, advanced arthritis or balance issues. How easy or hard, or even if you can do this, will be able to give you a really good indication of your general fitness, strength and wellness. So if you struggle with this, here's 3 exercises that you can add to your daily. Start with the lunge. So the lunge is where you stand with your weight evenly distributed over both legs. You step forward with one leg and the knee of the other leg dips to the floor. Make sure your knees are not extending over your toes in the front leg. Hold it for 3 seconds and step back to your starting position and repeat with the other leg leading the way. As an advanced option, try a lunge on an uneven surface, so like a Bosu or a balance ball. Alternatively, turn your lunges into walking lunges and walk up and down the hallway with them. And if you're starting small, use the wall and build up gradually. The next one is the hamstring stretch. Now there are a lot of options with this one, but my favourite's lying on your back with a strap over your foot. Gently pull the strap forward until you feel a nice, gentle stretch. Hold it for 30 seconds and then repeat with the other leg. And again, this is about listening to your body. It's not about extremes, it's about regularity. And lastly, everyone's favourite, the plank. This is all about engaging your core so you don't hurt yourself. As you're already on the floor stretching your hammies, roll onto your front. Visualize your belly button reaching towards your spine and zip up your pelvic floor. Then get into a push-up position and hold for 2 minutes. Start with 20 seconds if it's a little challenging and just build up over time. Metric number 10, breast examination. October is Breast Cancer Awareness Month. Now breast cancer affects men and women. Finding an anomaly early is your best chance of recovery, so make sure you know what normal looks like for you. So just because you have an inverted nipple, for example, it doesn't necessarily mean there's an issue. If you were born with an inverted nipple or 2, then that's your normal. If your nipple suddenly moves inwards, then that's not normal for you, so best to get it checked for peace of mind if nothing else. Now here's how to do a self-examination. Stand in front of the mirror with your hands on your hips. You're topless. Notice what your breasts normally look like. Check for any skin puckering, any redness, a rash, or a nipple that has moved inwards when it's normally facing outwards. Next, raise your hands above your head and check again. Is there any fluid coming from one or both nipples? Have you noticed any skin puckering, redness, rashing, or the nipples changing direction? Now it's time to palpate your breasts. You use your opposite arm to feel each breast. Left arm palpates the right breast, for example. You want to use small, firm, circular strokes. So think of a clock face. Start at 12 and move all around the face of the clock. You're checking for any unusual lumps or bumps, and don't forget to check all the way into each armpit. Next, lying on your back, do the same thing. Palpate using your opposite arm to feel each breast. Left arm palpates the right breast, right arm palpates the left breast. Use small, firm, circular strokes just like before, thinking of that clock face starting at 12, moving all the way round the clock, all the way into your armpits, checking for those unusual lumps or bumps. Now remember, lumps and bumps are normal, especially if you have large breasts. So don't worry if you find one. If it seems a bit weird or it changes shape or size between examinations, check with your doctor for peace of mind. And if in any doubt, refer it. Metric number 11 is all about blood sugar. So your blood sugar is a good indicator of insulin sensitivity or the potential for diabetes. You can do this test yourself or at a laboratory after speaking with your doctor. There are a variety of tests. There's a website, the Centre for Disease Prevention. It's got a great table on the different tests and the ranges for normal, pre-diabetes and diabetes. Check the blog for the link to it. Now, if you find your blood sugar is on the high side, try increasing your fibre intake. Ensure that you're well hydrated and add some exercise into your life if it's a little on the low side. Nothing fancy, just a 30-minute walk each morning can help. And research some low glycemic foods. The glycemic index ranks foods according to how they affect your blood sugar levels. So foods with a measure of 55 or less are considered to be low glycemic foods. And low glycemic foods, these tend to be less processed, have more fibre and more complex sugars in them. So they require a bit more processing by your body, and because of that they don't trigger the typical insulin spike that you see with high glycemic foods. And lastly, metric number 12 is all about HDL to LDL ratio. So HDL and LDL refers to the different types of cholesterol that you have, high density lipoprotein and low density lipoprotein. Now your body needs cholesterol, so not all cholesterol is bad, but we prefer the high density variety. HDL or high density lipoprotein helps your body to get rid of excess cholesterol, so it's less likely to block your arteries. LDL, on the other hand, transports the cholesterol into your arteries where it can collect in your artery walls. So if you combine that with some systemic inflammation, you're going to increase your risk of heart disease or stroke. To calculate your cholesterol ratio, divide your total cholesterol number by your HDL cholesterol number. So if your total cholesterol is 5.2 millimoles per litre and your HDL is 1.3 millimoles per litre, your ratio would be 4:1. The higher the ratio, the greater your risk of developing heart disease. A ratio above 6:1 is considered to be a high risk. And our goal is a ratio of 3.5:1 or lower. The lower, the better. If your ratio is not optimal, adjust your diet by adding in more fibre-rich fruit and vegetables and move a little bit more. There are also some wonderful herbs that can support heart health and cholesterol management. So there you have it. Something for each month of the year. Pay attention to these 12 things, and in a year's time, you'll be in great shape. Sending you lots of love. Bye for now.
Hey, thanks for listening to today's podcast. Can I ask you a favour? If our conversation spoke to you today, could you please take a moment to leave a 5-star review? Your review will help people discover this podcast, and together we can create a world where there's even more love and more laughter. And if you want to hear more from the Project Joyful podcast, just click the subscribe button. Bye for now.